Radiosurgery New York specializes in non-invasive cancer treatment choices. First in America, first in New York, first for you. Body Radiosurgery Cancer Treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe, including prostate cancer. Our innovative radiosurgery hits the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment chance for you, even if chemo, radiation, or surgery didn't work. Our cancer treatment is outpatient with most insurances, Medicare, Medicaid accepted. Minutes could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. Radiosurgery New York. We're super convenient, 38th and Broadway in Manhattan. Radiosurgery New York. Call 212-CHOICES, 212-CHOICES to hit the cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman here on the Radiosurgery Hour. I'm here with Ariel. Good morning.
Good morning. We're live.
We are live. You can pinch us. We're so live. We're live. We came here in this cold, in the morning, in the darkness, just to be with you.
Yeah.
Yeah, it's good, right?
Yeah.
Hey, we got a couple other cases, and there's always a learning point in each case. So whatever we're talking about, there's a learning point, a teaching point. So when you go see your friends or your neighbors or your family, you can say, wow.
I learned something today.
I learned something today. It's good to learn something today.
Yeah.
Right?
So what am I going to learn?
Well, we learned a lot, right? We
Yeah,
already
but
talked about breast cancer, that mastectomy is not so great. Just because you have a mastectomy doesn't mean the cancer doesn't come back, right?
Yeah, it can still come back.
Actually, it comes back even more than if you have lumpectomy radiation. So you learned that. And I saw that you texted to your friend the latest data that was out yesterday.
Yes.
So she's got a pretty good friend. I mean, you give her an article from yesterday, and you know that her mother's scheduled to get mastectomy, and there's no reason for it. There's no good reason for it, right?
No.
So you learned that.
We learned that.
Right? You learned that if you've got bleeding from the rectum,
Follow up your symptoms.
it's not hemorrhoids necessarily.
It could be.
It might be, but if it's not, you might die.
Yes.
Right? You might die. So just a bad guess means you can pay the price. We don't believe in bad guesses, right?
No, we don't.
No, we don't. So I have a couple people I want to talk about today further. We have a gentleman who came in, 68-year-old man with prostate cancer, PSA 6. You want to know his options. Well, obviously, unfortunately, when men get biopsied, they get biopsied by urologists, and urologists are often the ones who are doing radical surgery. And people often think, wrongly think that if you remove the prostate wrongly, that you're home free, right?
Yeah. They think you cut it out and that's it.
You cut out, you're home free. Well, okay. If you go to the chief of surgery at a big cancer hospital pretty close to us, and you have a PSA 4 to 10, so right in the middle, this man is a 6. PSA 4 to 10, you do radical surgery at this big cancer hospital. What's the likelihood of being cancer-free if you have that surgery 5 years later?
Well, what would you think? You would think he cuts it all out.
Yeah, you think it's cut it all out and you're home free, right?
But
it ain't true.
So what is it?
It ain't true, okay? It ain't true. It's a big misconception. They're deceiving you. It's not true. They know the facts. They know the facts. The number is 76%. If you have a PSA 4 to 10, you have radical surgery by the chief of urology at this big cancer hospital, the chance of being cancer-free is 76%, not 100%. And furthermore, so you have 25% chance of the cancer coming back. Most men lose sexual function. Many men lose urinary function, which means they're peeing in their pants. You get a shorter penis. Do you know that radical prostatectomy shortens the penis? Did you know that?
Yeah, I've heard that.
Yeah, well, we have documentation of that now. So I have documentation of that. If that same man came to us with a PSA 4 to 10 and underwent our treatment, which involves radiosurgery plus brachytherapy 5 weeks of treatment, not 9 weeks of treatment, the success rate is 90%.
What's the difference between 90 and 76?
Well, it's about 14%, and you heard there's more than 200,000 men a year with prostate cancer. 14% means?
A lot of men.
Almost 30,000 men lives saved. 30,000 men lives saved if you came to us than if you had radical surgery. So we urge people like this gentleman, learn the facts. If you still want radical, go ahead and have radical. It's a free country.
At least know the facts before you do it.
Yeah, then don't cry. Don't cry when the cancer comes back. Don't cry when the sex life doesn't work. Don't cry when the urinary life doesn't work. Don't cry when your organ is a little bit shorter than it used to be. Don't cry because you knew in advance. You knew in advance. The problem is that the people often don't know.
They don't have the information.
So if you have all the information and you want radical, go ahead and have it.
It's a free country.
It's a free country. Do what you want. If you want to live and keep your sex life and urinary life and avoid radical, call us at 212-CHOICES. 212-CHOICES. We'll sit down. We'll meet. We'll go over the facts. We'll talk about our thousands of patients that we've treated over the years and how they do compared to surgical results. And see the facts yourself. It's a free country, but you're also free to get the facts, and you're free to get the information, and you're free to inform yourself. And we believe it's really important to know the facts in advance. That's how you arm yourself. That's how you defend yourself. That's how you protect yourself and protect your life, which is so important.
Get the facts.
Get the facts. So we're talking about that man with a PSA 6, but we're talking about actually any person with cancer. We had another patient who came today, came this week, with esophageal cancer. He was diagnosed 2011. He had surgery and chemo and standard radiation. All right, so he did what he was told. And 2 years later, in March 2013, the cancer came back in the liver. For 1 year, he's had chemo. It's
a lot of chemo.
And I say it a lot because he had a year of chemo. You can imagine a year of chemo.
Must be unbearable.
And imagine that it didn't work. Not one of the treatments worked.
So you keep going in all the time.
Kept on going in, getting his shots, getting his chemo, didn't work. You know, we tell people, look, okay, you're going to choose chemo, that's great. It's a free country again. But get evaluations, get a PET scan, get cancer markers. There's cancer markers like CEA that are often valuable. And if you know your markers, get copies of your reports. Read your reports. We give people copies of the reports on discs so they can see their images. They can read
They have it. Yeah. They can take it home with them.
If the treatment's not working, it's time for a change. It's time for a change. So this man came. He's got a huge mass, the size of a fist, growing through the abdomen now from the liver. It's painful. It's big. He hadn't been staged. He gave up. His doctors gave up. We staged him. And most likely for esophageal cancer, and we have data to show this, and you know we have data to show this, most likely we can stop that mass or shrink that mass and take care of the pain with 5 treatments, non-invasive 5 treatments. So you might take this as the initiative to look at our esophageal data and start updating it again, which we keep on doing periodically. But this man we can most likely help non-invasively, without cutting, without bleeding, without chemo. Sure, you can have chemo if you want, but you don't necessarily need it. And the goal is to try to shrink down that mass, take away the pain, and get that mass going in the opposite direction. And most likely we can do that. I'm very hopeful that we can do that. We also had some great results. We had a man came in last year. He had lung cancer. It spread to the brain. He's a very creative man. He's a man that's done a lot of artistic work, and you've met him. He went to a hospital, and we talked about before the ping of hospitals. Went to the emergency room, saw a tumor. He had the neurosurgeon remove the tumor, and luckily he got out without complications. But had he come to us, we could have treated that without neurosurgery, without opening his head. He's got a big scar from one ear to the other ear on top of his head.
Yeah, I saw that.
Yeah. So he got a big scar. And they had a second tumor that was deeper. So how is it?
So they got one but not the other.
They took the superficial one but not the deep one.
Why?
Now, does it make sense that we can treat the deep one and the superficial one, But if we can treat both with radiosurgery non-invasively...
Why take all the risk and cut it open?
Yeah, why take the risk? I mean, you know what the risk is for craniotomies, opening up the head to remove a tumor?
It's not easy.
Well, it's not inconsequential. The risks are about 5% of death or stroke. So opening up your head is serious business. We have a huge experience. We were the first in New York with fractionated stereotactic brain radiosurgery. That means pinpoint radiation for treating brain tumors non-invasively with no screws in the head. Unlike another system that has screws in the head, our system is totally non-invasive.
And you've treated over 5,000 patients.
Right, so this man came back to us this week, and guess what? Everything's better, nothing's worse. He's doing great, fully intact, off of his medicines for the tumor. He's very, very, very happy. We got a PET scan of the rest of his body, no cancer. So the 2 tumors in the head we treated, controlled, the body negative. He's happy. His wife's happy. I'm very happy. So this is the end of the hour. We're available if you call us at 212-CHOICES during the week, 212-CHOICES. We have a free booklet. We take most insurances, Medicare, Medicaid. We'd urge you to make an appointment, come in and meet with us, go over the data. We'll review the data, give you copies, talk about the real options. My name's Dr. Lederman. We're at Radiosurgery New York, 1384 Broadway. Ariel, thank you very much.
Thank you.
Have a great weekend, and God bless you. Thanks for all.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
77 WABC. This is where New York comes to talk. Legendary 77 WABC. New York, a Cumulus station.
From ABC News, I'm Dave Packer in South Carolina. Police arresting a man in connection with yesterday.